Scrotox.
Oh, yeah.
Is that a thing?
Yeah, Scrotox is a thing. Yeah.
Well, spill the beans. Blue balls.
She goes blue
Well, you
balls.
got a cure for that.
Yeah.
Just inject those puppies. Oh, okay. Let's just get down and dirty.
Okay.
The penis. Welcome, guys. It is time for episode number 2 of the podcast, which we titled Behind the Scalpel with me. And I will bring guests onto the podcast to talk about different topics in aesthetics and aesthetic plastic surgery. And today I have the pleasure of talking to Summer. Hey, Summer.
Hi.
How are you?
So happy to be here.
Well, it's wonderful to have you here. I got a shout out to your parents, and I'll tell you why. Because they were spot on when they named you, because you are like a ray of sunshine. You are positive all the time. You come in with a warm, inviting smile, and I'm certain that when patients get to know you and see you, that they are put completely at ease and ready for the treatment because they know they're in great hands.
Well, thank you. That's my goal.
Yeah, so tell the viewers a little bit about you and where you're from and how you made it to ACPS and what you do at ACPS.
Okay, so I'm Summer. I'm one of the RNs here at the MedSpa, and I became a nurse in 2019. I worked in the hospital in Dallas, moved into plastic surgery where I found just such a passion and love for aesthetics and helping people gain confidence and feel good about themselves. And I feel like it really takes like a certain personality to really
Yeah.
comfort people when they're not feeling good and to just help build their confidence. So even if it's not with an injectable or a laser, if it's just with your kind words. So I feel like I love doing that stuff, and it makes me feel very fulfilled and just helping people in any way. I love it. So that's how I found my way here at ACPS. I'm so happy to be here, and I'm not leaving. So I'll be here for the rest of my life.
Yeah, you should. You're awesome. And I've known you for a few years now, and I've just seen your practice grow and you mature in the practice that you have here at ACPS. And your patients just adore you. And, what's not to adore? I mean, you're wonderful. But today we've got kind of a little bit of a controversial and a bit of a taboo subject to talk about, even in 2024. And that is enhancement of lady parts and gentleman parts. And, it's kind of euphemistically speaking about male and female genitals. And it's kind of not a topic that comes up around the Thanksgiving dinner turkey, with mom and dad and grandma. But, I mean, you're seeing patients coming in for it. How did you become interested and develop a practice for these kinds of services that you're offering male and female patients?
Well, I think that having patients come in and talking about everything that bothers them from head to toe and creating a rapport with the patients where, I see them often and we grow very close, and then they end up telling me they're having sexual health issues or they're having intimacy issues. And I have always felt very comfortable in this subject because I really just in the hospital I was dealing with a lot of vaginal packing and like Foley. So I always kind of worked in that area. It's never scared me, bothered me. I know my anatomy there. And so it just I don't know, I feel like I had a calling to it.
Yeah.
And then when I started here at ACPS and I was following Dr. Hustak, who specializes in our vaginoplasties, I was like, I want to do this. I want to help women with their confidence, because if you don't have confidence in you as a woman or a man in your sexual health, then I mean that if that's something that we can improve, then we need to.
Well, as I was saying earlier, I mean, you have that personality that draws patients in and makes them feel very comfortable. And, especially in the work that we do in aesthetics and aesthetic plastic surgery, it's tough to have patients come in and reveal very intimate and very tough things to talk about. And but I think they feel very comfortable and confident that you are not only not going to judge sort of what they're coming for, but you're going to help solve problems for them. Well, sex is a messy and complicated thing, right? So it's not just getting a shot in your JJ and wiener and you're off to the races.
Yeah.
I mean, you have to have a good relationship with the person you're with for sex to be worth anything.
Agreed.
So this is just kind of, I mean, you got to have a strong base in the person you're with. And you say that a lot of times the women that come to see you bring their man in to see you, and the
Yes,
men
they
are willing, because it's important to them, to be there supporting the wife, and they are interested in contributing to the health of their sexual health as well, their relationship.
Yeah, the couples that get these treatments together, first of all, I just love them because if someone is willing to work on themselves and the other partner is too, that just says so much. And,
Exactly.
you know, I have seen it where patients think that it might be the wife, but it's both parties. And
Yeah.
so when they both get treated together, they are more satisfied, and I really feel like it creates
A
like
bonding
a bonding
experience.
experience. Yeah.
Absolutely, absolutely. So it's not just one. It's not just one person doing the fixing.
Yes.
You gotta have both.
And when someone is told to fix something about their body by their partner, there might be a little resentment behind that. I say that very loosely, but that can hurt someone's feelings. So doing it together,
Right.
I think, unloads some of the responsibility on one partner, and
Right.
You're
But it
doing it
also
together.
implies, it's a little bit of condescension because it implies that the other person's perfect as they are, and it's
Yes.
you're the one with the problem. Go get it fixed.
Yes,
Go get the
exactly.
G shot or the
Yeah.
G spot shot. Go
Yeah.
get the Miva. It's not me.
The
And you
vaginoplasties.
had, and we've talked off camera about these situations too, and it's kind of, difficult area to tread.
Yes.
Because, I mean, you wanting to guide patients in a direction that is healthy for them. And so sometimes you have to say, yes, this is a good treatment, or no, this is not a good treatment for you.
Yes. And, like you said, sometimes it's hard for people to, bring up the subject. And just when you come in, you are not being judged. I've heard it all. We have all heard
Oh, God, yeah.
so many things. And, at the end of the day, you're trying to fix yourself and make yourself feel better.
Yeah,
And
that's the business we're in.
yeah, that's the business we're in. There's no judgment, and we want to help you.
Absolutely.
Truly.
Absolutely.
Okay.
The penis. Some guys, most guys,
Yeah.
are worried that it's inadequate and
Yes.
that they're not going to be able to satisfy their partner. So they are interested in having it be made more plump. So how is that done? Is that possible?
Yes. So that is done with HA fillers. It doesn't add length, but it can add girth, and maybe up to 1 to 2 inches for some, depends on the
Around.
patient.
Around,
Girth.
not length.
Yeah, not length. So how that's done is it's actually very comfortable. We numb the area.
Thank God.
Yes, yes, thank goodness. And we don't use a sharp needle for the entire procedure. We use a cannula, which is like a little tiny blunt tipped straw. So
Right.
think of like a straw and how it's not very sharp, but we're just kind of going around the
But
tissue.
really,
filling-
really narrow.
Yes, very narrow,
Yeah.
tiny, teeny tiny.
I wouldn't want a real straw in my wiener.
No,
But
absolutely not.
the cannula, I mean, the important difference, and this may sound like we're splitting hairs, but the difference is that a needle has a sharp beveled cutting edge, and a cannula does not. So it can go through literally wind itself through the tissues very gently
Yes.
and deliver the product in the area of the anatomy where you want it to be safely
Safely.
and with less trauma of the tissues. So less trauma means fewer side effects, less bruising, less swelling, quicker recovery.
Yep.
So it's better to do it this way.
It is better. And, there are, as long as people really do their aftercare and do what they need to do, abstaining from sex for 2 weeks because you don't want to mold that filler in any way. You want to let it settle completely. And then
So 2 weeks.
2 weeks, yes, 2 weeks. And just take care, don't do anything crazy.
Right. And then they
Abstain.
come to see you at 2 weeks, or when do they come to see you to see if they're doing fine or if they may need more?
It is good for patients to come back in 2
Oh,
weeks
by the
to
way,
reevaluate.
okay, sorry to cut you off.
No, no.
How many syringes are
So
required usually?
typically, the least amount that I've ever done has been 8, and almost all the time the patients want to come back for more. So usually the minimum needs to be about 10 syringes.
And each cc is, pretty small amount.
Size of a
So-
blueberry.
Yeah. And you need all 10
Yeah.
for it to be noticeable. Okay.
Yep.
And how long can a gentleman expect this treatment to last?
About a year. It
Pretty good.
depends. Yeah, depends on how, our bodies and how quickly we metabolize things. So, really depends. It's so hard to say like exactly when, but
Yeah.
and it depends on which fillers used. About a year is what people can expect.
Yeah.
Yeah.
This is kind of a delicate question, but does it also depend on the use?
Yeah. Yes, it can. Because if it's being, molded down and friction and whatnot, then
Right.
it can make it leave the body quicker.
Right.
That's like, fillers in the lips.
Yeah.
They don't last
Good
as
point.
long as fillers in the cheeks.
You know what? You stole my thunder because I was going to say the lips are in constant motion,
Yes.
talking, eating, smiling, and they're animating.
Yep.
And fillers it's hostile territory to filler, even fat. And when I inject tear troughs, which is up here, it doesn't move very much. And fillers can last like years. Whereas it may
Years.
last maybe a few months in lips if you're lucky. So I guess, the more
Yeah.
use you get, the more you're going to need.
Yep.
I'm guessing is the
Erosion.
lesson to be learned. Erosion, yeah. Or more maintenance
Yeah.
is required the more you use.
Yes. Yep. So,
So maybe each year come in for a reeval
yeah.
and see if the desire is to fill the tank
Yep. Exactly.
and get back to where you were the previous year.
Exactly.
Now you heard it
And
from the expert.
yep. And the treatment's actually pretty comfortable,
Yeah,
numbing.
because they're numb.
And we offer Pronox, which is laughing gas, for any treatment in the med spa. So if you need it to kind of take the edge off, then we offer it.
And so, ladies first. So let's talk about the ladies. And what do you see are the treatments that your female patients are coming in for restoring health and function of their vaginas and their vulvas?
And so where I like to start with all of this and what most people usually need is a PRF injection. So a lot of patients ask, what is PRF? It's platelet-rich fibrin, different than platelet-rich plasma because the fibrin has white blood cells, more growth factors. It's spun and made a little bit differently. There's no additives like with PRP. There is usually an anticoagulant in the tube. So it's more natural overall and it works longer in the body. So that's why PRF is so amazing and I'm so proud that we offer that because a lot of people who even offer the PRP, they don't offer PRF. And
Right.
PRF is known to work better. It lasts and it works in your body for about 10 days versus with PRP, it lasts about 10 hours of working. So that's kind of the main difference between those two. So the most common one that we do is the PRF it's really called the Oh My shot that we do.
Oh my.
Oh my. And you know what? It is not so oh my. It's actually very comfortable The process really quickly, I draw your blood, I numb you down there for about 20 minutes while I'm spinning your blood, gathering everything.
Yeah.
And by the time I'm injecting it right near the clitoris and then right in the G spot. So this is going to help with vaginal lubrication. If a patient has urinary incontinence problems, it's going to help with that. It's going to help with stimulation in the clitoris and G spot location. So it does wonders.
Right. The G spot, that's kind of a controversial part of the anatomy for women. And, if you read some of the medical literature, some people fall on one side of the fence or the other. Some people believe that it's a real thing, that it's an important area for stimulation in women, sexual stimulation, and some people are on the other side that say no such thing exists, that it's all anecdotal. Where do you fall on that?
I mean, I think it's true. Even if we're injecting PRF into the G spot area, which when we're saying that, clinicians can usually feel they can feel where the tissue is a little bit different. They say that's where the G spot is.
Yeah.
And so that's where we're injecting it. And let's say it's not. What is an orgasm? A contraction of the pelvic floor muscles. And if we are injecting PRF into the pelvic floor area and it's strengthening and we're getting nerve regeneration, then it's still working.
There are a lot of growth factors in PRF and restorative factors in PRF. And the G spot is actually an anatomical area that's inside the vaginal cavity and the front wall, so it's closer to the bladder and sort of close to the exit. And so when patients come to see you for the G spot or the oh my shot, that's where you're injecting the PRF after
Exactly.
you prepare them. And you numb them up before you do the shot, so it's really pain-free when the shot is actually being performed.
Yeah. And a lot of people get nervous about it, but then once we're done, they usually say, that's it. I mean, they're shocked. They really are. And if they feel anything, it's 2 pokes. So it's
Right.
like little tiny pinch, and I use the size of the Botox needle. So it's
It's
tiny.
pretty tiny needle.
So little pinch, 2 pinches, we're done.
Now, you also offer a G-spot filler, which is different than PRF.
Yes.
So what's the difference there, and and you and I have talked about this off camera before. How do you incorporate both treatments into the practice you have and what's offered at ACPS between PRF and hyaluronic acid filler for the G-spot?
So, and I will say, for the G-spot filler injection, that is usually for someone who is struggling. Let's say they feel like they are about to, go all the way and achieve orgasm, but they're just not quite getting there, but they feel like they're going to. And
The worst kind of delayed gratification.
exactly, the worst. And so usually these are the patients that feel like if that spot was easier to reach, quote unquote, that they would actually achieve orgasm. So what we're really trying to do is we're trying to push it forward into the vaginal canal so that during intercourse it is reached more easily. PRF is a good first treatment, I would say.
Yeah.
The G spot filler injection really is not guaranteed. I know patients where it works for some. I've had patients where it hasn't worked, but it's usually where, we're at the point where they're like, I'm willing to try it. So that's kind of when we do the G spot filler injection.
Now, when they have filler in the G-spot area, what's your advice to them after they've had the treatment? Do they go home and test drive it? Do they wait? What's your advice?
My advice for the filler injection is to abstain from sex for 2 weeks. because you don't want to have intercourse and rub that area down where you actually want it to stay plump and full, and you don't want to, smooth it down at all. So no sex for 2 weeks. After 2 weeks, you're clear to have sex.
Okay, awesome. You also do fillers of the labia. Tell us about that.
Yes. So anyone who feels like they have lost volume in that area and maybe they see a little bit of laxity in the labia majora area, we can
So
do
there are
filler.
two areas of the female anatomy that we call labia, and you mentioned the majora. That's kind of the outer lips,
Yep.
and there's a minora. So we're talking about filler of the majora, the outer lips.
Yeah, filler of the majora. We don't do it in the minora. So,
There's something else for the minora. We'll talk about it in a
yeah,
minute.
we'll get to that later. But yeah, so if someone feels like it is a little lax or they want it a little bit tighter, sometimes that means that they've lost fullness in that area. So we can do filler there, and we can try that as well, just for it to look better.
That can happen in the course of a woman's life that changes the anatomy. Aging, pregnancies, going through menopause, that's a big one, that can create atrophy
Yep.
in all of the areas of the anatomy that we're talking about. And so these services that you're providing are really restorative
Yes.
of the female anatomy. And it's not just improvement of the appearance, but it's also improvement of how the function is,
Yes.
which is, important.
Very much
It's
so.
not just for self-esteem, but it's, how that affects a relationship
Yeah.
with a partner. I'm going to mention a couple of things that I do, and that can complement the services that you offer in the spa.
Absolutely.
Liposuction in the mons, which is sort of the lower part of the abdomen, can make that area look better, especially look better in clothes. Women are always telling me how they hate wearing tight-fitting clothes and having that stick out. And so liposuction works great there,
Yeah.
and it makes the area look better, and it complements the procedures that you do. And I do also, you do fillers with HA,
Yeah.
hyaluronic acid, but I also use fat as a filler for the labia majora.
Yeah.
So that's one of the things that I have done in my practice to restore the health and function of the female vulva is plump up the labia majora with their own fat. And it's permanent. Well, it's permanent enough until, the aging continues, and but certainly it's something that can be repeated.
Yeah.
So
That's a great option.
that's a wonderful option. I'm going to mention a couple of other things that are surgical options for ladies, and that's labiaplasty, which I do. It's an operation of the labia minora, which are the inner lips, and often, again, with aging, pregnancies, vaginal deliveries, they can hypertrophy, they can get larger, they can get uneven, they can even interfere with intercourse. And I've had many patients say not only are they not happy with how they look, but it can be painful having relationships with their significant others.
Yes.
And so there are different techniques to tidy them up, trim them up so that they look better and function better. And so labiaplasty is an operation that I do. And I'm going to give a shout out to Dr. Hustak, who's the queen of vaginoplasty. And vaginoplasty is an operation to rejuvenate and tighten the vaginal canal.
Yes.
And she offers this procedure. It's a surgical procedure. She even does it under local anesthesia. But there's another option that you do to help tighten tissues.
Yes.
Tell us about that. I'm trying to be a mind reader, or maybe I'm forcing you to be a mind reader.
No, Thermiva.
Thermiva.
So Thermiva is it's a tool that we use in our med spa, and it is a wand that has radio frequency on it. So it heats up the tissues and it stimulates collagen and it helps tighten up that area. So it's really wonderful. It really helps with urinary incontinence, anal tightening.
Lifesaver.
Yeah, so which I mean, that's one of the biggest things that I hear
Yeah.
all the time. With the Thermiva, I do want to say we do require a well woman's exam clearance before you get this done.
So
Yeah.
I think what you're doing is exactly right. Having a woman undergo a well woman exam to make sure that everything is healthy before you do a treatment that
Yeah.
can sort of turn
Spread
loose
or,
the HPV,
yeah.
which we don't want.
Yeah.
So there's surgery, there's minimally invasive, and there's non-invasive. So there are different things that can be done.
Yeah.
And most of the treatments that you offer, or all of the treatments that you offer actually, are done under local anesthesia, no going to sleep, no deep sedation of any kind, and they go home.
Yeah.
And they follow the instructions, they follow up with you.
Yep.
And are many of these treatments, one and done, or what's your recommendation for maintenance of these different treatments that we've been talking about?
Yeah. So some of them are a one and done for some patients. It seems like if a patient is really healthy and they have a very good inflammatory response where their body's going to stimulate collagen and react very quickly and well to these treatments, that's wonderful. They can do a one and done. So I feel like I see those patients about once a year for these treatments. But then I have patients who they come in and they want to do the package of three that's about 3 to 4 weeks apart. They want the best, results possible.
Yeah.
And they do see good results. There's a benefit to doing all of these things in sessions of three because we're building collagen on top of each other, and it takes a little bit for collagen to form, right? I really think that's the best approach, but not everyone needs that.
Time for the body to heal and form collagen
Yes.
in the area of the treatment,
Yes. And
whether it's PRF or Thermiva or any
yeah.
of these sorts of treatments.
Yeah, and that's very interesting as well because I have patients who, when I follow up with them 2 weeks later, they say, I have not, I sneeze and usually I have urinary leakage. I have not leaked ever since the shot.
Yeah.
So it's like it can work really quickly for some, but then there are studies that show that it can improve over 8 months. So it really just depends on the body.
Amazing stuff. And
I know.
gosh, improvement in the sexual health, improvement in urinary incontinence, improvement in confidence, improvement in, going out for dinner and knowing that if you laugh loud at, a joke that's told, that you're not going to have an accident and have to deal
Yeah.
with that. So
You
these,
can wear that white jumpsuit, ladies.
oh, yeah, and feel free.
Yeah, yeah.
There are things, oh, I was going to ask you because you brought it up, that there are certain patients probably are not ideal candidates. And you mentioned that a person that has these treatments has to be able to have a natural and normal inflammatory reaction to the treatment for the
Absolutely.
treatment to be effective.
Yes.
So which patients would you say are really not ideal candidates for these treatments?
So patients who do not have a healthy immune response, patients who are on medications that are anti-inflammatory. So, because really what your body is doing with these is it's relying on the inflammatory process to, heal and to stimulate collagen and to help with the nerve regeneration. So, if your body's not reacting to this correctly, it's just not really going to work. So, one example is like Humira. If someone has an autoimmune disease and they're on Humira that decreases the body's inflammation response, then this just might not work for you and we might need to find another option.
Or these days, people are always taking a baby aspirin for heart health, and they may not even, that may not even register as a medical therapy that they're doing, but they're doing it anyway.
Yes.
And it's important to know that because your advice is going to be either don't do it or the expectations are not going to be ideal while you're on an anti-inflammatory, and aspirin's an anti-inflammatory. Well, we talked about the ladies, but you also offer services for the dudes.
Yes, I do.
What are they, and how do you treat the men that come to see you?
So the most common one right now is the PRF again, so the platelet-rich fibrin. So, Speaking to the patient and finding out what their problem is very important. And so if a man comes in and says, you know, I am having trouble keeping an erection, or I have lost sensitivity, then we will want to do PRF. We can put it in different areas depending on what the problem. If we put it kind of on the corpus cavernous, then that will help kind of make you last longer. So there's that. And then if you put it in the glands, then that can help with stimulation.
So PRF is the go-to to enhance sensitivity
Yes.
and to help with things like not being able to reach erection
Or to keep one.
or to keep one. But you also do hyaluronic acid fillers of the penis. What are you using hyaluronic acid for?
So that
Pray tell.
specifically, specifically the hyaluronic acid filler is to enhance girth. So the PRF does not increase size. That's more so for the feeling, but the HA filler will increase in girth. Usually it does take a lot of syringes, I will say, but for the most part it is very safe. There's always risk, with filler. But we use a cannula,
Not a needle.
not a needle.
Yeah.
Yeah, a cannula is a blunt tipped way to insert the filler and so that you don't poke a vessel.
See, not only do you need to see someone who has, by doing serious medicine and having experience and knowing anatomy, like the back of your hand, but knowing how to do things efficaciously, but also with safety in mind. And you're
Yes.
advising patients who come in, who's a candidate, who's not a candidate, how to do the treatment safely, where to inject the filler, what technique to use to do the filler. I mean, all these things are things that you know how to do because you're a pro and you know how these procedures should be done.
Yeah.
Whereas if you go someplace where the injector isn't aware of these important things, then probably the service is not going to be ideal.
Nope. There's a lot of risk, behind things like this. So it's very important, I feel like, to come to a place where people have been trained really well. And like you said, they have a history of like working in the hospital. You've got to
No.
have someone who is well trained and just knowing that you guys are upstairs or at Post Oak across the
Right.
hall.
Right.
That is so important. We have 8 plastic surgeons that we work under, and I think that's just huge.
Right. Yeah. Tell them where the spa is located at both facilities. We have a spa at the Post Oak location, Post Oak Parkway, and we also have a spa at the Kimberly location.
Yes,
And you
yes.
mentioned that, you guys and the plastic surgeons work hand in hand, and our work is very close to each other.
At Post Oak Parkway, we're on the 3rd floor, the clinic side and the med spa side. The med spa is on the right, the clinic's on the left. And here at the Kimberly Lane location, also Town and Country location, med spa we kind of have 2 right now.
I know.
But so as soon as you
We're
walk
expanding.
in,
We're growing.
yeah, we're growing big time. And I feel like we're not stopping here.
No,
We're gonna
no,
keep
not at all.
expanding. So, med spa here at Kimberly Lane location, first door on the right as soon as you come in, that's our main med spa. If you're seeing me or Lauren, you might be going to Suite 103, which is a little bit down the hall on the 1st floor. And then the clinic up here is on the 3rd floor. And then the surgery center is on the 1st floor as well. We've kind of taken over the whole building.
I know.
Yeah.
We talked about PRF, which is sort of the latest technology to improve the health and vitality of tissues like the G-spot and the penis. And it's an improvement from the older technology, which was PRP. But it doesn't just stop at the penis and the G-spot. I mean,
no.
what do these treatments also, what do they accomplish? Where else can you use them to create a rejuvenation in patients?
You can do hair for hair restoration, and you can also do the under eyes for dark circles. I've even done it in acne scars, and I've seen it's just the most amazing response for acne scars. So I really suggest it for that.
And people who have acne, suffered from acne,
Yeah.
as young people, and they go through life with residual effects of having acne when they were younger and having scars. This is incredible that you can offer something as simple as a shot
Yeah.
to improve something that can affect someone's self-esteem, like bad acne scars.
Yeah. And the fact that it's just coming from your own body. I mean, how amazing
Right.
is that? Full circle.
It's you treating you.
Yes, exactly.
So nothing foreign that goes into the preparation of these treatments.
Yep.
So
Another really cool area is, especially here in plastic surgery that we do, is the areola area, the nipples, anywhere kind of in the breast where people have lost sensation, which even non-surgical patients experience that. But, with our surgical patients, there's always a little bit of a risk if, you might lose some sensitivity there. And so you can inject it in that area to help regenerate those peripheral nerves.
another erogenous zone. We were talking about,
Yeah.
the relationships between people doesn't just begin and end down south.
Yep.
I mean, you can go in different parts of the body and have that complement your sexual life.
So true.
And so for women who have decreased sensation of the areolas, you're offering a service that can improve and make that so much better.
Yeah.
Scrotox, is that a thing?
Yeah, scrotox is a thing. Yeah.
Well, spill the beans. What is it?
So
I know what it is, but I want to hear from you.
Yeah.
Does it work?
It works. If
It's Botox. There's no such new medicine called Scrotox,
yeah.
but we use it for the scrotum.
Yes. And so that can help.
It is a thing, believe it or not.
Sorry. So Botox can help relax the scrotum, and so it's going to be more smooth looking, and sometimes it can help them descend.
More relaxed.
Yeah, they look more relaxed.
Not high and tight.
Not high and tight, yes. And then also, if a lot of us know that Botox also helps with sweating, and so it could help with that too, if sweating in that area is an issue.
I know.
So
And it often is. We had the episode number 1 was on sweating from the armpits, and here's sweating for the boys.
yes, for the boys.
So they not only can look better, but they can be drier
Yes,
and ready for the summer.
absolutely.
With summer. Oh, by the way, I noticed your beautiful glow. What's up? What's going on there?
I got a Fraxel today.
What's Fraxel since you have it done? This is a wonderful thing. We are true believers in what we do.
Yes.
We just don't deliver these services, but we believe in them and believe that they are helpful for different things, for different patients, and we are consumers of these treatments too.
Yeah.
You are, I am too.
Yeah. I really try every year to get about 4 lasers a year. So I
So
feel
this was your laser for today.
this
you were due
this
for
has been my
Fraxel.
second laser this year. So I'm on a good schedule.
So what does Fraxel do exactly?
So Fraxel, it's a dual wavelength laser. And we have settings that can be tailored just for you. So if you're more concerned with pigment, then the 1927 is going to help with that surface area and help get rid of pigment.
This is where it gets a little bit medical
Yeah, that's true.
and scientific.
That's true.
So
Yeah.
it's these numbers. It just means the quality of the light that comes out of the laser machine. There are just 2 different kinds of light, and so they do
Yes.
2 different things.
Yeah.
And so you know how to control the lasers so that your target, which is the skin,
Yep.
is treated in the way that you want to treat it.
Exactly. So, and then the other wavelength that we have, that one is going to help with, lines, wrinkles, textured skin. So the good thing about the Fraxel is you can pair those 2 together. And that, to me today, because I do have some fine lines around my crow's feet, if I don't have my Dysport Daxify done religiously, I will get on here. And I want to increase. I know.
Well, where can people find you on I know that I see you almost every day, either at the Kimberly office or at the Post Oak office spa, but people can also find you on social media.
Yes. So Instagram is kind of where I think I'm the most active. My handle is @NurseSummer, all one word. I'm usually like the first person on there when when people put that. So that's where they can find me. Yep.
I mean, when we're here, we take our job very seriously and we do great jobs, but, it's kind of fun also to kick back and do videos like this that are educational, but,
Yes.
that help them know that we're like normal people too.
Yeah, we're normal people, and this is nothing to be ashamed of. At some point in our life, we will all struggle with our sexual health at one point or
Right.
another, but it's all about managing it. So, and you have the power to.
Well, you heard that. So if you guys want to see Summer or see me in consultation, just give us a call and we would love to take care of you.
Yes, we would.
Great chatting with you. And well, we'll see what our next episode will be. But this has been a fun one. I've enjoyed it immensely.
I enjoyed it.